Welcome, everyone. Thank you so much for joining us today as we discuss the fundamentals of musculoskeletal health. Before I go ahead and jump in and introduce our speaker, I do want to review just a couple of housekeeping items for the best user experience. So that being first, all attendees are going to be in listen-only mode for the duration of the webinar, meaning you're going to be muted. We won't be able to hear you. If any viewers have any questions, comments, anything like that, please go ahead and utilize the chat box that is located at the top right-hand corner of the webinar screen. For audio access, attendees can use the computer audio or they can call in and use the phone option. And finally, presentation slides and resources that we will be discussing today will be able to be downloaded by clicking on the paper icon that's located on the right top hand corner of your webinar screen. So now into some introductions. My name is Rachel Shoney, Kinetic Health Specialist and Certified Health Coach here with Apex Benefits. And here I'm excited to announce I've got Dr. Nicholas Jasper here with me today from Ortho Indy. To give you a little bit of background about him, he attended medical school at Indiana University. Woo, go IU, right? Any of those fans? Yep. And completed his internship at Kettering Medical Center, as well as his residency in physical medicine and rehabilitation at Virginia Commonwealth University. He also completed an interventional spine and sports medicine fellowship at the Orthopedic and Spine Specialists Sinai Hospital, Baltimore, and is board certified in physical medicine and rehabilitation, as well as sports medicine by the American Board of Physical Medicine and Rehabilitation. So, no doubt, a very qualified physiatrist that we have here today with us. So, without further ado, Dr. Jefffer, I will go ahead and hand it over to you.
All right. Well, good afternoon, everybody. We're going to go through some basics, sort of musculoskeletal injuries that we commonly see at leisure and in the workplace, and there are a wide range of those. So we're going to go over the most common causes of these workplace injuries, talk about a little bit more of what are the most common injuries that do occur um, uh, from work, whether it's heavy labor activity or whether it's sedentary work. Um, Talk about the impact of these injuries that it has on individuals and the workplace and employers, as well as talking about the basics of prevention and different treatment options that go along with these common injuries. So, what is a musculoskeletal injury? Well, it's any type of injury that affects the muscles, nerves, tendons, joints, and then when we talk about our back, it's looking at our disc within our spine. Um, these account for around 30% of all workplace injuries, so it's very common. There's a higher rate of these types of injuries in manufacturing, healthcare, construction, and transportation, um, as well as warehouse work. A lot of those environments where there's a lot of repetitive bending, lifting, twisting type of activities, and sometimes they're foreseen and sometimes they're unforeseen. So sometimes whether it's um, police officers or firefighters, they have in stressful situations where they get in these situations where it's sort of a flight or fight response, and they do what they have to do to get the job done. And after their adrenaline comes down, they realize these injuries sort of start to settle in, a couple of days later after the fact. And so that's where we get some common calls in and says, "All right, yeah, I felt fine. The first day after a day or two, I started feeling pain in my shoulder or in my back or knee." And then it's our job's here to sort of evaluate that and sort of see what's the cause and what can we do about it to treat it, right? But The most common causes of these workplace injuries, um, it's the top three. You can sort of generalize them into sort of more of an overexertion or tiredness. So, if you're doing some repetitive work on an assembly line, and you're working 12-hour shifts, it's monotonous work. You're not getting breaks or those types of things. You can get some injuries with not being sort of on point with cognitively with the activities that you're doing, and to get lazy and with how you're doing things. So whether that's tripping over something, whether it's leaving something on the floor, whether it's getting your hand in the conveyor belts or something of that nature, it's that those are common mechanisms for overexertion and tiredness. And then the contact with any of that type of equipment or object that can be a variety of things. This is a very generalized thing. I mean, it can be the motor vehicle accident that you get caught in, transporting goods, or um, whether that be some falling objects from a warehouse pallet, or a forklift in the warehouse factory, and then the slips, trips, and falls. I mean, that's essentially any environment that we work in. So wet, slippery floors or surfaces, objects that are on the floor, loose cords. Those are common things that can be easily prevented with proper attention and housekeeping and maintenance of the workplace environment. So, talking a little bit more specifically, overexertion and tiredness, it's going to be about 30 to 35% of workplace injuries. So I may have touched on this earlier, or the repetitive bending, lifting, carrying, kneeling, pushing, pulling, doing those things repetitively are going to put more strain on different joints, whether it's the shoulders, neck, back, or knees. And this is where sometimes you also see some injuries with more repetitive stress as far as sedentary activities with carpal tunnel syndrome, or wrist injuries or elbows due to a lot of excessive keyboard use, those types of things. So the biggest takeaway for prevention of this is trying to take frequent short breaks from the activity. Sitting at a desk, prolonged sitting, you get really into your work, and time flies when you're trying to um, meet a deadline and working on different projects. It's important to have sometimes even setting a timer on your iPhone, and taking a 5-minute break just to stand up, and do some simple stretching of your back, or taking a walk to get a glass of water, go to the bathroom, and come back. It's going to be good to help your body move. So, you'll hear me talk a little bit on it later, but exercise is medicine, or any type of activity is going to be good for your overall health and injury prevention. All right, contact with any type of equipment or object. So, about a quarter of workplace injuries. So, this is going to be you know, your motor vehicle accidents, forklifts, driving on a bus and getting in car accidents. You know, whether you're bumping into or stepping on something at work. Um, you know, for the healthcare providers, or that are out there, getting involved with, or violent patients, or family members that are in the hospital, that you get thrown around, or if you're a teacher in a setting and you have behavioral kids that are difficult to control, those are going to be the stressful points where, all right, you can get injured by trying to keep kids safe, or the patient safe. Sometimes we forget about ourselves, and that happens. It's trying to be aware of what are the best ways to prevent those things, and how can we do that. Um, any body part being pinched, squeezed, compressed crushed, these, different types of equipment injury that occurs in, the factory settings or warehouse settings, um, you know, or being, in a, as a firefighter being involved in, any type of collapsing of structural equipment or materials that fall on a construction site. You know, these are all different types of injuries that can occur, and the biggest thing is safety. So you hear what safety first is sort of our one of the mantras that I try to teach patients in prevention, is and with this stuff at work, it's looking at more of using personal protective equipment in the cases in which that's available. So if you're on a construction site, using hard hats, gloves, safety glasses, earplugs, steel-toed boots if you're in construction or on a warehouse setting. Um, but and then the slips, trips, and falls. Another approximately quarter of the workplace injury. So this is going to be the easiest accident to avoid. It could be as simple as somebody, turning around and leaving a file drawer open and a colleague tripping over it, or the different electrical cords. So working on keeping the floors dry, clean, safe of debris, anything that you could potentially trip over, being aware of it, and then marking those areas that are wet, and trying to prevent those falls from occurring, are going to be important. So the types of musculoskeletal injuries that we see, head to toe. I mean, we see, I see a lot of neck and back pain is my primary practice, so I see this a lot. We see a lot of people carrying around, stress, just from work itself. It occurs, more as more myofascial type of pain, so more stress in the neck and upper shoulder girdles. This can lead to headache issues. Proper improper posture, body mechanics can cause more issues with back pain. When we talk about overhead lifting and repetitive use of the arms, shoulder pain, rotator cuff strain, tendonitis issues, rotator cuff tears potentially. Same thing with the elbow and wrist. You can get those tendonitis issues there as well as some carpal tunnel issues in your wrist, which can cause some numbness and tingling in the fingers, and can radiate up the arm a little bit as well. Um, Knee pain, ankle pain, those are going to be the things that happen, most commonly with slips, trips, falls, repetitive bending, kneeling activities, you know, and so those are going to be the most common things that we see in the office, from a workplace injury. So this is sort of generalized for anybody, whether they're have a sedentary job or a heavy labor intensive job, are at risk for any of these types of injuries, really. And so it's just being aware of what they are, and what we can do to prevent them, and then how we, if we do suffer from them, how do we go about treating them the best, right? Uh, So low back injuries, I mean, this is where most of the common things are more strains and sprains. When we get concerned is when you have a disc herniation. It can pinch a nerve, and then that can cause more pain shooting down either your arm or leg. Um, and again, we see this as a lot of heavy lifting, repetitive bending, lifting, twisting, poor posture or body mechanics in the neck and low back, um, and improper lifting techniques. So shoulder injuries, we talked about this a little bit. The overhead use is going to be, and the heavy lifting and overexertion are going to be most commonly cause more of the tendonitis issues. Some of the traumatic injuries, then it's going to be more of the fractures and dislocations, and then that can occur, and then the rotator cuff tears can occur if more repetitive use happens, and that tendon just gives away. And so, obviously those things can be treated, are going to be needed more surgical treatment than some of the conservative treatment if it's more of a fracture or rotator cuff tear. The hand injuries, if you get, more, this is more common, with the carpal tunnel syndrome, but, with the, traumatic injuries, you see crush injuries and fractures of the digits. And so those, again, it's just trying to prevent the falls that can occur at the workplace, and then being more attentive when you're working in a factory setting of what's going on in your environment around you, so you don't have any sort of distractions while you're working on the line. Knee injuries, again, more of the occurs with falls. So ligament tears or meniscus tears, are the things that may need some surgical intervention. Some of the bursitis issues and around the knee, or aggravation of osteoarthritis pain, can be treated more surgically. Sometimes when it comes to ligamentous tears, some of those may need more surgical interventions. Foot and ankle injuries, again, this is more of the falls. We commonly see the sprains and strains of the ankle, and it's just being, again, more cognizant of the workplace environment to set up those signs, be aware of lips in the concrete that you may catch a foot on, or any work that's being done in the workplace, making sure that's properly highlighted. These musculoskeletal injuries cost a lot, right? And so they cost the employee time off work, they and pay. It's lost productivity for the company. There's increased costs, involving surgery, physical therapy, medications, and ongoing care. And then, some of the, indirect costs can be just as impactful for everybody involved. So, again, looking at lost productivity due to pain or limited um, mobility, uh, the efforts that are needed to retrain a person that has been on the job for 5, 10, 15, 20 years. Hiring a new employee, it takes time, especially with some of those people who are pretty niche at what they need to know. It can take some time to get them to that productivity level that the previous worker was doing. And then this also affects the employer's insurance premiums. That there's a lot of more work claims, and their insurance premiums go up. So, I mean, sometimes the overall burden for these injuries, when you're thinking about direct and indirect costs, can be, a big number, 200 to 300 billion dollars, in the country. So that's a lot. Um, so these are the things we want to avoid, right? How we sit. There's a lot of office jobs, a lot of everything that we do. Just getting set up for this talk, we're talking about how we need to be sitting right, right?
Yeah,
And
absolutely.
so now, all right, this is where you're going to, the proper seat, proper desk setup is going to help relieve pain and stress on your neck, as well as your low back. You want to take time away from sitting at the computer. You want to, like I said before, get up and stretch. Sometimes, do a little uh, stretching at the desk, or walking around. May look funny in the office, but it's going to be good for your health. What's good for your health is good. It's going to be good for everybody. Um, you know, Low back pain. For people working in the schools, sitting in properly sized chairs. So, there's a lot of kids' chairs in the schools. So, right, sometimes there's staff that are sitting on the ground doing work with kids, or, sitting in a kid's chair trying to help with educate the child. If they're constantly doing that can be a lot of stress put on their back as well as their knees. Um, and, and so simple things being made in those environments can be helpful. All right. Um, Repetitive hand movements when typing. Well, just trying to do some flossing exercises with your hand. Moving it back and forth, up and down, trying to loosen up some of those tendons and that go through your wrist here, so it's not constantly in a fixed position when you're working at the computer. Um, you take care of your posture and body mechanics, you're going to have less stress, you're going to have less muscle tension. That's going to decrease the amount of tension headaches. Sometimes stress isn't, not, is always going to be there in some way, shape, or form with way we're living, right?
Yep.
And so it's being aware of how we can, address that, and talk to colleagues about that. All right, it's known and work through some of that stress because that's going to also affect how you feel. So stress does play a significant role in some of these physical ailments as well. It can make neck pain and back pain and headaches symptoms more prevalent the more stress that you're under. So it's good to also, I didn't speak about it in these slides, but mental health is very important to our productivity. So, that's something we can't ignore. And, so looking at this is where, all right, all the different types of things, with, you know, prolonged sitting, what it can do to you. All right. So there's a variety of things, head to your toes, that they can cause problems with. So good alternative is looking at getting a standing desk, exercising on a routine basis, trying to get at least 60 minutes of exercise 5 days a week, which is a lot and it's challenging, but some of that can be spread, a 30-minute walk in the morning and some 30-minute activities, in the evening before you go to sleep. All right. But, having a standing desk can help improve your posture, from a functional standpoint on your spine. It's going to take less pressure, or it's going to put less pressure on your back. We think of standing, in general, puts more pressure on your back, and sitting doesn't, but that's actually the opposite. Sitting puts more pressure on our low back than any other position. So it's important to stand. It helps reduce the risk of cardiovascular disease, osteoporosis. It enhances your cognitive ability. Being able to get out and walk, that's going to help release your body's endorphins, help make you feel good. It's going to help you maintain or lose weight, strengthen bones, work on improving your balance and coordination. Exercise. Those endorphins are going to help improve your mood, and help with any type of depressive symptoms or anxiety that you may be having. And it's also going to help your problem solving abilities at work and sometimes your creativity. So sometimes getting that getting your own space and own time to work through things is going to help you be more productive at work. And so it's not trying to um, push to push the envelope and redlining it at work, where you have good intentions. Sometimes they can have a negative effect. So it's important to sometimes put yourself first and take care of yourself, right?
Absolutely.
So proper lifting techniques. So this just demonstrates sort of ways we talk about lifting. So lifting with your knees is what we tell people. All right. The bottom shows you how some people lift, and that's how we learn to lift when we're young and have this invincibility cloak, and we can do anything, and nothing bothers us. Um, but that's doing that repetitively over a 5, 10 year period in a dedicated career. That's going to put a lot of stress in degenerative changes that occur through your back. And this is where you're at higher risk for injuring your back. So it's important to lift with your knees, keep your back straight, and that's going to help you out in the end. With sitting, it's trying to keep yourself at a 90 type of um, uh, position, keeping your head straight. The computer screen should be at eye level or just slightly, 15 degrees below your eyes. And that's going to help reduce the stress in your neck, and as well as positioning of your hands and arms. It's going to help reduce the risk of carpal tunnel syndrome, right? So, and then standing, and, standing is trying to focus on proper posture. So it's avoiding the slouching forward or the slouching back. But again, standing take any type of standing over 8 hours of sitting is going to be good for you. Right. So prevention is going to be the best treatment for all these musculoskeletal issues. Okay, about 20% of employees, have a wellness program, or there's wellness programs out there, but sometimes it's estimated that only 20% are aware of these programs. So sometimes it's out of the employers, and it's in the best interest of the employers to really make these, encourage employees to take advantage of all the things that the human resource department offers for as far as benefits. And then trying to make these alternative workstations more friendly, and having the right ergonomic situation and set up for the employees is going to be beneficial, because lost time at work um, doesn't help anybody, the employee or the employer, in the long run. So spend the money up front, and you're going to save a lot of money on the back end of things that can occur with some of these chronic injuries. Treatment, relative rest, it depends on what the issue is, but this is just more of a generalized scope of practice that we utilize. Um, is more relative rest, type of work restrictions if necessary, working on physical therapy, whether it's your back or neck or shoulder. Sometimes it's medication treatment to help calm down some of the pain symptoms. We can do diagnostic testing that, whether it's in the form of x-rays or CTs or MRIs. Um, injections can be done to help with some of these pain symptoms. Ultimately, with some of these catastrophic injuries or more traumatic injuries, surgery is needed. But in a large population of musculoskeletal injuries, 90% of them are going to be treated conservatively. Um, so we're running towards the end here, wrapping things up. I mean, I'm here to answer any questions that may have popped up here, or if you do have any questions that pop up after this, feel free to give me, our office a call. Happy to see you in the office to help with any of you out there, or any of the employees or employers. Feel free to email me with any questions.
Awesome. Well, thank you. Well, it looks like right now, no questions, but a question that I have myself, something that I feel like I've heard maybe from others, and maybe you've heard this question as well. What is, I guess, what do you tell patients when it comes to maybe how do they tell the difference between, oh, this is just an ache or a pain versus something that I need to see someone for?
Yeah, I mean, and that's a challenge sometimes for a lot of people. Is all right. Well, I'm just gonna wait and see, let this play out, and see how it goes. If it's affecting your function, if it's impeding your quality of life,
Mhm.
it's important just to see somebody and get it checked out, and we can put your anxieties at ease. You can get the reassurance you need if it's nothing to worry about, or if there is something that needs addressed, then we address it. But I mean, I think the biggest thing is addressing those concerns up front, and then and then we can take it from there. Yeah.
Wonderful. Awesome. Thank you so
No
much.
problem.
So with that being said, if anybody has any additional questions, like Dr. Jasper mentioned, please feel free to reach out to us with this contact information that's actually been provided. You can download the slides if you are watching the recorded version of this. If you need to reach out, please go ahead and do so. But I just wanted to thank Dr. Jasper
Yeah.
here. Thank you
And
so
thank
much
you.
for joining
Yeah.
us today and discussing this topic with us. I also want to thank our viewers. We appreciate your engagement and, of course, hope that you join us next week, or excuse me, next month for our next webinar. So thank you guys so much. Have a great afternoon.
Thanks, guys.